the question presented to us today was, is CBD something that can help to reduce my chronic pain? I was talking to a friend. They said they felt a little bit better when they had CBD. I've heard a lot of positive anecdotes, subjective accounts. Is it something that's actually proven to help to reduce pain? Well, in short, actually, albeit CBD is a phytocannabinoid, meaning it's a cannabinoid that comes from plants, right? Phyto is plants. And so it can bind to and activate cannabinoid receptors, which anything that typically does that would turn down pain signals. The research shows that CBD alone probably won't have any substantial effect in reducing chronic pain, right? And so any more than a placebo effect. So the short answer is no, it probably won't help with chronic pain. But we would never end the video at that and just tell you good luck. There is something that they've done some research on relatively recently that is a similar type of compound and all natural, and that's palmitoyl ethanolamide. Palmitoyl ethanolamide. What the hell? Also called PEA. This is a lipid-like molecule that's endogenously produced in the body. That so in other words, it's a fat-like molecule, or so even produced from fat inside of your own body endogenously, right? Is what that means, and it does not bind cannabinoid receptors directly, but it does induce the activation of other endocannabinoids, activates cannabinoid receptors, and increases the synthesis of endocannabinoids, meaning cannabinoids that are produced within the body. Remember, CBD is a phytocannabinoid. That's something that comes from plants, right? And so palmitoyl ethanolamide, hypothetically should be able to turn down pain signals in increasing the synthesis and activation of cannabinoid receptors and their activity. And indeed, it has been shown to do so, albeit to a modest degree, in people with chronic pain and also in people without any pain, which is very fascinating. So let's talk about a few trials here. The first one was a meta-analysis, involved about 774 people, and this came out a few months ago. These were 774 people with chronic pain from all different sort of disease and disorders, and it gave them anywhere from 300 to 1,200 milligrams of PEA per day. And if you take 1,200, that's typically divided into 3 doses of 400 milligrams. And they had about a 17% reduction in their chronic pain on average at the end of 2 to 3 months. So, pretty neat. It's not a huge reduction, but 17%, pretty reasonable. And they measured these reductions via visual analog scales, VAS, subjective scales, where they pretty much will ask them questions and they write, yeah, I feel this less, I feel that less, whatever, yada, yada, yada. Another trial, it didn't involve quite as many people, but it was a randomized control trial involving 14 people that had no pain. Very interestingly, these people had no chronic pain, and what they did was they induced pain. They induced pain by beating them up. No, I'm just kidding. They induced pain by, you gotta have fun, right? They induced pain with needle pricks and with heat and with cold, right? So cold-induced pain, heat-induced pain, needle prick, pressure-induced pain. Now they pretty much induced the pain up to the degree where it was tolerable, and they said, okay, that hurts, no more than that, right? And not where they were like, oh my God, help, but they induced pain in these people, right? And so after taking 1,200 milligrams a day over the course of just 1 month, they had about a 10% reduction in pain on average. So, pretty consistently, this anti-inflammatory compound that's produced in the body, PEA, palmitoyl ethanolamide, if you guys are late to the party here, is something that shows some promise, at least in preliminary research, for reducing chronic pain and has some potential for doing so. And they're not sure of the exact mechanisms by which, but we do know that it activates cannabinoid activity. We do know that it increases the synthesis of endocannabinoids, cannabinoids that are produced in the body. Endo is within in the body, right? And so, maybe a better option than CBD. Now, how much to take? I think we should go more towards that 1,200 milligram per day dose, because that they use that in both trials. And again, the first trial with the 774 people that was meta-analysis, that utilized anywhere from 3 to 1,200, but there was relatively high heterogeneity between the studies and the results. And so, I gave you the average pain reduction, and that was, again, 17% or so. But, when there's heterogeneity like that, it's not always a bad thing, but it means, there were disparities in, how people were affected, right? So I think personally, a lot of that, if we've seen success at 1,200 milligrams for 1 month, and they were doing this for 2 to 3 months, with the induced pain like we just talked about, then, probably the people that didn't feel as much of a pain reduction were to that lower end of the dosage range. Maybe they didn't have enough. And there are a lot of things out there like this that have a lot of benefit to our health, but if we have a small dosage, it doesn't quite do enough, right? And omega-3s are a great example. You look at every trial that's failed with omega-3s, they'll use less than 3,000 milligrams, right? They'll use less than 3 grams. And some of them are corrupt studies that were designed to fail, where they would, purposely give people, a gram of omega-3s, and they would have no reductions in joint pain or inflammation and things of that nature. No reductions in inflammatory markers in the brain and all sorts of stuff, or improved blood flow as much, or heart health, benefiting heart health. But then when you see the ones that were 3 grams and up, it's pretty unanimous across the board that they provide benefit. So 400 milligrams of PEA 3 times a day if you're somebody that has chronic pain. If you're somebody that wants to try CBD, and talk to your doctor if you take any medications before delving into this. But pretty neat stuff. Preliminary research, nonetheless. Show some promise. Who do we got on here? Let's say hello to the homies. Do a push-up and then say hi. We're already down there. Might as well do a push-up. What's up? CL Rigo. Yeah, a lot of people, look, I'm not trying to rip on CBD at all. I'm really not. I just, that's what the research says, based on some randomized trials and meta-analyses. When you take all the research into account, and I got that from Examine. They're a great source. So, I hope it works. I hope it works for people. What up, Rice Cerrone? How you doing, girl? What's happening? Yeah, but that's good, Guillermo. Whatever gives people results, right? The proof's in the pudding. If people are getting results, then that's great. CL Rigo. They hate Shawnee. What's up, my man? Sertali. Chivo Stronger. Gilbert Kielis. Preston, what's up? Preston Coral. Coral? A.L. Housen. What's up, you guys? We have a lot of OGs on here today. Gary, what's up? How you doing? Anthony Graham. How are you, my man? Tim Zimmerman. Thank you, Guillermo. Appreciate that. Edwin Eddie Rodriguez. D. Sharon. We see these people out here. We've seen them before. We'll see them again, I hope. Travis Rum. Luciano Bros. What's up? Thanks for all the love all the time. Dapper Dalal. My man Malcolm. Hassas 89. How you doing, brother? Thanks for coming on. Frexo. And the first one of the day was A. Del Rey. Hey, what's up, A. Del Rey? Thank you for coming on today. That's all I got to say. And we'll be back tomorrow in another way. Thanks for coming on. I hope you have an awesome day. This one's for you. You were the first one on. I appreciate the love and support. And go do something great for yourself. Luciano, Holly, what's up? You guys have a fantastic rest of your day. It's all we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Enjoy. Thanks so much. And happy Wend Wellness. What up? Caving Nuke at the bell. See you later.